Hello, my name is Lorraine Luttrell. Today we are going to be discussing asthma, its pathophysiology, the impact that it has on population health, some of the common medications used, their side effects, how best to prevent asthma, how to monitor if treatment is effective, and the health promotion of the disease. Asthma is a pretty common lung disorder in which inflammation causes the bronchi to swell and narrow the airways. This narrowing of the airways creates breathing difficulties that can range from mild to life-threatening. Symptoms include shortness of breath, cough, wheezing, and chest tightness. Here are some interesting points that I found when doing my research on asthma. Please review the slide for this information. This picture adequately allows one to visualize what the airway is like for an individual who is not suffering from asthma versus an individual that is suffering from asthma. You can see that the person that is suffering from an asthma attack has a severely constricted airway. Asthma begins with a trigger. A trigger is introduced to the body, causing airway inflammation, excessive mucus production, muscle tightening, and swelling in the bronchial membranes. This all leads to a narrowing of the breathing passages, which leads to the common symptoms of wheezing, cough, shortness of breath, and chest tightness. Asthma affects over 300 million people worldwide, and it is said that 1 in 12 people suffer from asthma. In the US, 3,500 people die annually as a result of this disease process, and annual healthcare-related costs are estimated to be over $50 billion per year. Asthma is controlled with both short-acting medications and long-term control medications. Short-acting medications might be administered during the acute phase of an asthma attack. These include beta-2 adrenoceptor agonists, anticholinergic medications, and adrenergic agonists. Long-term control of asthma involves use of corticosteroids, long-acting beta adrenoceptor agonists, leukotriene receptor antagonists, and mast cell stabilizers. Below is a list of these common medications as well as their side effects. Please review. Here are some key tips for asthma prevention, as well as a copy of a common asthma action plan. Here are the most common factors that a provider will utilize to determine if your treatment is effective for asthma. Proper control of asthma is imperative. Adequate asthma control will prevent chronic and troublesome symptoms, reduce the need for short-acting medications, help someone maintain good lung function, maintain a normal activity level and sleep through the night, and prevent asthma attacks that could result in an emergency room visit. In conclusion, some key points that one must follow in order to avoid asthma attacks include avoiding triggers in the first place, following an asthma action plan, and communicating effectively with your physician. Thank you. You have a nice day.